Hey everyone, imagine having this AI assistant, right? One that helps you go through like tons of medical research or even like helps you personalize treatment plans for your patients. It's wild, right? And that future, it's closer than you think. And that's kind of what we're talking about today, giving you the tools to figure out how to use AI in healthcare.
Yeah, it's really incredible.
So today's deep dive, it's all about this thing called prompt engineering.
Hmm.
Basically, it's like learning how to talk to AI, how to get it to understand exactly what you need from it. Like, are you speaking its language?
Exactly, yeah.
And we're looking at an episode, it's from the Medical AI Practice and Innovation podcast. They had Professor Alexander Zerno and Dr. Elena Ultrakova on, and they break down this whole prompt engineering thing in a way that just makes sense. It's super practical.
Yeah, it's like they're giving you the cheat codes to the future of medicine.
Yeah.
Professor Zerno, he actually uses this great analogy. He compares like mastering prompt engineering to learning a new medical instrument.
Oh, interesting.
You know, it takes that same kind of practice, precision, that deep understanding of your patient to get those amazing results.
I love that analogy. And before they even jump into the how-to, they do this really smart thing. They actually talk about what AI actually is, like really ground the conversation.
Right back to basics.
Yeah, and how it's already being used in healthcare, which I think is really important. Like, think about it. AI is already analyzing scans, looking for those early signs of a disease,
Right.
potentially freeing you up to spend more time with your patients.
Which is huge. And it highlights this crucial point.
Mm.
AI is meant to help you. It augments your expertise. It doesn't replace it.
Exactly. This isn't about robots coming in and taking over, right? These
Yeah.
are powerful tools, but they're here to work alongside us, not instead of us. Okay, so Dr. Ultrakova, she gets into explaining this whole prompt engineering thing, and she describes it as, and I'm quoting here, the art and science of crafting effective inputs or queries, called prompts, to guide AI models. Okay, so that's a mouthful.
It's a lot. But think of it like this. Imagine you're asking a colleague a question, right? If you're vague or like unclear, you're probably not going to get the info you need.
Mm.
But if you're specific, you provide context, you're much more likely to get a response that's actually helpful. It's the same with AI.
So it's not just about knowing the right answer, right?
Right.
It's about knowing the right question to ask.
Precisely.
Yeah.
And like nowhere is this more important than in medicine, right? Where clear communication, that can be the difference between like a correct diagnosis and a missed opportunity.
It's huge, yeah.
Huge.
And their point is totally clear. Mastering prompt engineering, it's not really optional anymore. It's becoming essential.
Yeah, it's the future.
Yeah, as AI becomes more and more integrated into our workflows, our ability to communicate with these systems effectively, that's going to be paramount. It's almost like learning a new language.
It really is, yeah.
But in this case, the language of AI, that can be the thing that helps us unlock better patient outcomes.
And what I think is fascinating is how they break down this like seemingly complex skill into these clear, actionable principles. They even give like real-world examples of good prompts and bad prompts.
Oh, interesting.
Yeah, which I found incredibly helpful.
Let's dive into those because I think that'll make things crystal clear for our listeners too. So what's the first principle they unpack?
So the first principle, it's all about clarity. It's clarity and specificity. And they actually use this example. They say, like, instead of asking, tell me about diabetes, you want to be way more specific, right? So ask something like, what are the latest treatment guidelines for managing type 2 diabetes, but in, like, elderly patients?
Oh, okay.
So it seems kind of obvious, but being that specific, it really makes all the difference.
Yeah, it's like if you walked into a library, right, and just asked for a book. The librarian they'd have no idea where to even begin.
Right, exactly.
You have to tell them what you're looking for.
You got to be specific. And AI, it's kind of like that. Like, it's brilliant, but it's also very literal-minded,
Yeah.
You got to be clear, got to be specific, and know how to get the AI to the right answer.
Okay, so clarity, specificity, check. What's the next principle?
Okay, so the second one they highlight is this, providing context. So imagine you're trying to, like, request medication options for a patient.
Okay, yeah.
It's super important to tell the AI everything. Like, how old are they? Do they have any other conditions, allergies? Like, you got to give the AI the whole picture.
So it's not just a list of symptoms, it's like their medical history is part of the equation too.
Exactly. It's like when you're talking to a friend. Right?
Yeah.
Sometimes you have to, like, give them the backstory first.
Yeah, totally.
Context is everything.
Context is key. Okay, so we've got clarity and specificity, providing context. What else?
All right, so this one's interesting. It's called structured formatting. So Professor Zerno, he actually suggests, like, organizing your prompts, but like organizing them into sections.
Oh,
Almost like imagine you're writing a clinical note.
okay. Yeah.
So you'd have like, a section for like patient information, then like clinical question, and then desired format.
So you're basically giving the AI a roadmap.
Exactly.
So it doesn't get lost.
Precisely. It's like streamlining that whole communication process.
Yeah.
And it really helps you like zero in on that information you need so much faster. Okay, and the next one, it seems, I don't know, maybe a little straightforward, but it's actually really easy to mess this one up.
Okay.
Be concise, but comprehensive.
Okay. So no like rambling story.
Right.
But we also don't want to leave out like key details.
You got it.
Yep.
And then finally, they stress iterative refinement.
Iterative refinement. Okay.
Yeah, and this is basically don't be afraid to like treat it like a conversation. If the AI gives you a response and it's not exactly what you were hoping for,
Yeah.
you can just tweak your prompt a bit. You can add some more context and then try again.
It's almost like those medical mystery shows,
Yeah.
where the doctors, they keep asking questions, gathering more information, and they're constantly refining their diagnosis until they finally like crack the case. Yes. I love that analogy. That's perfect. Because it really does capture the whole like spirit of prompt engineering. So to really bring these principles to life, Professor Zerno and Dr. Ultrakova, they go through some examples. And they're like really good examples. Like, here's a good prompt, here's a bad prompt.
More interesting. The good, the bad, and the AI, right?
Exactly.
Give us the highlights. What are some of the examples they use?
Okay. So they start with this like classic bad prompt.
Yeah.
And it's something that like we've all probably thought of, right? Like, what should I do?
Okay, yeah.
Way too vague, no context. The AI is totally clueless. But then they give this great example of a good prompt. And they say, imagine you have like a 65-year-old male patient, history of hypertension, presents with chest pain and shortness of breath. ECG shows ST segment elevation in leads 2, 3, and AVF. And the question is, what is the recommended immediate management?
Oh, wow. Okay, yeah, that's a lot more specific.
Right.
You're basically painting a picture for the AI.
Exactly. You're giving it clear patient details, you're giving it symptoms, you're even giving it test results, and it gives the AI something to really work with.
It's like AI can work its magic, but it needs the right information to even get started. Right? Okay, give me another example. What other kind of like prompt pitfalls should we like watch out for?
Okay, so another one they highlight is like being too broad. Like if you just ask, tell me about treatment, that could mean anything.
It's cute.
Way too broad. But a good prompt, like list the first-line pharmacological treatments for acute asthma exacerbation in pediatric patients, including dosages. Now that's laser-focused.
Okay, so it's specific, it's targeted, it tells the AI exactly what you're looking for. Okay, these examples are great.
Yeah.
They really make those principles so much clearer. Did they address like any real-world questions, like about actually using prompt engineering in, our day-to-day work?
They did. They actually took some listener questions,
Yeah.
and they had some amazing insights that I think are like incredibly relevant for anyone, working in healthcare today, especially with AI becoming more prevalent.
Okay, let's hear it. What are the burning questions on everyone's minds?
So the first one is a big one.
Lay it on us. What's the first one they tackle?
So the first question is all about evidence-based information. Like, how can you be sure that the AI is giving you, trustworthy information, which is so important in medicine, right?
Huge, yeah. So how do we make sure that the AI is not leading us down the wrong path?
Well, Dr. Ultrakova, she has this great suggestion. She basically says, like, tell the AI what you need. Like, instead of just asking about treatment options, you could say something like, okay, based on the current American Heart Association guidelines, what are the recommended treatment options for?
Oh, okay, yeah. So it's like saying, show me your sources.
Exactly. You're basically forcing the AI to base its answers on, established medical knowledge.
I like it. It keeps things legit. What's the next listener question?
So this next one is something that I think, we're all going to come across at some point. What happens when the AI just gives you an answer that's like flat out wrong? Or just doesn't make sense?
Yeah, it's not perfect. It's bound to happen. So what do they say about those head-scratching AI moments?
Well, both Professor Zerno and Dr. Ultrakova, they both stress that you can't just blindly accept what the AI is telling you.
Of course.
You always have to double check, like make sure it lines up with your own knowledge and check those trusted resources.
It's like trust but verify, right? Can't let our own critical thinking skills go out the window just because we're talking to an AI.
Exactly. And, sometimes the AI isn't the problem. Sometimes it's actually the way that we're communicating with it.
Oh, interesting.
So if you get a weird answer, Take a second look at your prompt, Could it be clearer? Could you give it a bit more context? Maybe that's all it needs.
So it's really a two-way street. We've got to be clear on our end, and if something seems off, we got to be ready to, like, adjust our approach. Okay, last listener question. This one seems super relevant to, our everyday work with patients.
Okay, so the last question is all about using AI to explain things to patients.
Hmm.
Like, can AI help us be better communicators?
Oh, that's really interesting. Like, imagine having an AI that could, come up with these clear, easy to understand explanations that are, like, tailored to each
I
patient.
know, right?
That would be a game changer.
It would. And I think Professor Zerno and Dr. Ultrakova, they're cautiously optimistic about this, which I think is the right approach. They even give this example prompt, like, imagine asking it to explain in simple terms how insulin works in the body, like for a patient who's just been diagnosed with diabetes.
That is such a good example, though. That's exactly the kind of thing that could really help bridge that communication gap. But I imagine there's some pretty big, like, disclaimers here.
Absolutely. They emphasize that, like, human oversight is crucial. You can't just let the AI run wild with patient education. You always want to make sure that the information is accurate and appropriate and, sensitive to the individual patient.
So it's more like, you know, AI could be like a super smart assistant. Like maybe it helps you create like a first draft of some patient materials, but you're always the one who's ultimately responsible for what you're sharing with the patient.
Exactly. Human judgment, empathy, that's still irreplaceable in medicine.
Absolutely. So those are the big questions. Any final thoughts from Professor Zerno and Dr. Ultrakova? Like, how do they wrap it all up?
You know, they end on a really encouraging note. They urge everyone to embrace prompt engineering as this like ongoing learning process. Professor Zerna actually compares it to learning a new medical instrument, which I think is so fitting.
Oh, I love that.
It takes that same kind of practice and precision and that deep understanding to really get it right.
It's a skill. It's something that you hone and develop over time. That's awesome. Well, this deep dive has been incredible. It's like we got a sneak peek into the future of medicine. And it is, I don't know, it's a little intimidating,
A little bit.
but it's also really exciting. There's so much potential there.
Absolutely. And the best part is that we get to help shape that future.
We do.
The more we understand prompt engineering, the better we're going to be at using these tools.
Exactly.
Yeah.
Exactly. It's not something to be afraid of. It's something to, learn about and figure out how we can use it to really benefit, our patients. It's an exciting time to be in medicine. And for anyone listening who wants to learn more about AI and its role in the future of healthcare, I definitely recommend you check out that Medical AI Practice and Innovation podcast that we mentioned. They've got tons of great info. And let us know what other topics you'd like us to do a deep dive on in the future. Until then, keep asking those great questions and stay curious, everyone.